Alberto, Bram, and myself, and we are going to talk about care guidelines. Thank you very much. I will just give a very quick introduction and then I'll let Alberto continue. This is a presentation that we have prepared jointly in order to possibly answer some of, give some clarification of some of the questions that you have already raised in the last days. And I guess you have been asking quite a lot about care and how to improve care and access to care to patients all around the world. And I guess one of the question is always how to make sure that the doctor or the clinician or the therapist or the physiotherapist, the scientist that you talk with is expert and has the right answer to give you. So it's very important to make sure that we have the right recommendation, we give the right recommendation to patients throughout their lifetime and to families. And so the questions are, what are the right treatments, when to give them, what to do first, and how to anticipate and prevent complications. So really, the question is, how do we have care guidelines or recommendation of care for congenital muscle diseases, and in particular, of course, today we're talking about LAMA2. And this is why we have started some efforts to try to get some care recommendations. So there are quite a lot of challenges, of course. You heard already, these are rare diseases. We are aware that the numbers are probably higher than what we think, but the patients are rare and sparse around the world. And this often makes some doctors not expert because they might have never seen a patient or a child with LAMA2 muscular dystrophy, or perhaps even if they do see children and adults with this condition, they might not have the right tools and knowledge. And sometimes this knowledge is really spread around the world. And often you as parents and you as affected person living with a condition are probably much more acknowledged about the complication of the disease, and perhaps better than a doctor who has less expertise. So we really would like, as doctors who do see patients and families with this condition, to try to gather more knowledge and share it with as widely as possible with clinicians, but also with, of course, with families and patients, and increase publications and knowledge. And clearly, if you do not have guidance and there are no right interventions, there might be consequences like delay possible treatments or interventions, or delay preventable, hospitalizations. Like Alberto said, that some interventions are preventative in order to help care, like like interventions with PEG or ventilation. And if you perhaps delay some of these interventions, there might be some consequences. So it's important to understand what is the right recommendation of care and try to make sure that everybody has the same care around the world, and not that somebody is living in one country or the other has different care, and somehow leveling the field, so make every patient receiving the same care, also helps trial readiness, because all the patients around the world will have the same standards of care and make them leveled when the treatment comes, when other treatments come available. So maybe I can let you go from here.
Thank you very much. Okay, so I think I want to mention what Bram said before, like one of the dilemmas. I think it's important for families to understand. So we have the same objective, so improve the care for patients, but I think there is a lot of discussion between clinicians and patient representatives regarding the guidelines, because of course as clinicians we need to work within a framework, we need methodology, we need scientific-based evidence, and this takes time. But on the other hand, there is a need of now having recommendations, practical guidance now from the families. So I think this was a point that emerged from the ENMC workshop that we performed at the beginning of this year. So actually the workshop aim was to, so the aim of the workshop was actually to find the methodology to build the expert care recommendation for LAMA2. So we gathered in the Netherlands with other experts in the disease, and we basically talked about every single aspect of the disease. But what was the output was a document which in theory should be a first step toward the recommendation, but we try to design it in a practical way so that it can be already a document that can be used. But it's important to distinguish between, again, what is a recommendation and what is a scientific guideline that requires a whole process, which is quite complicated. So on the other hand, what we learned from LAMA2, of course, some of the lessons that we learned can be transferred to other CMDs, but of course we are well aware that every single congenital muscular dystrophy has its own peculiarities. So again, we need to balance what is common, what can be transferred, but also what is specific. And at the moment we are working on creating a document, like a living document, which will be online, which will be practical for physicians who are not expert in the disease. And we decided to divide it by vital system, let's say, so respiratory, orthopedic, nutrition, etc. So where the physician who's not expert can access in a practical, easy way and fast way, quick way information without having to read through, let's say, 90 pages of recommendations. And what we want also to aim at is to build it in a way where you have like optimal, so what is needed and what can be applied wherever you are located in the world. So also taking into account local differences, not aiming for the best, but aiming for what is real and what is doable. And then, of course, there will be an optimal. And then we will also try to outline what is important for each different condition. So the way we envisage this document is something which is practical, maybe app-based, multimedia-based, something that can, upon which we can build our knowledge. So if new recommendation, new evidence comes, then this will increase the level of evidence for each recommendation, and we will be able to answer more and more questions in the future thanks to new research. So I think this could be, and this of course it's driven by QSND and Forsara, so there is a real push from the Patients Association and also to keep us as clinicians on focus, like on practical objectives and not on discussion about methodology, etc. So we hope that this will be a really useful tool for clinicians around the world. Again, the objective is to create something simple, but it's not easy to find the balance between simplicity and then being naive, let's say. So we need to give information, and that will require a lot of work and a lot of working groups. We will start with working groups based on experts, but we are open to new inputs in the future. So that's how we think about it, a sort of Wikipedia-like tool where you can apply wherever you work, because maybe you work in different countries, but you have knowledge about the disease, or you see a patient which is different, who is different, and you can provide new information or ask to update, upload. So that's an objective that we hope we will manage to complete. So we need help from the whole community, as I said. So of course there are the experts, there are the researchers, they have their own clinical experience. I was talking with a mother before, but with rare disorders, every patient is new information. So everything you've learned up to there, then you assess a new patient, you talk with another people, and you understand that there is something you missed. So it's an evolving process. And this is why it's important to have feedback from patients and families, and to create a platform by which we can communicate with the same lay language. As we said, communication is important, so we need to speak the same language. And of course, we need funding and partners to bring this to a living document, something that works. So I think I've said everything. I don't know, Bram, probably you want to close up, or I thank you. So he's here for mental support. As long as he doesn't organize a crowdfunding match between me and your kickboxing, I'm okay. So, so thank you very much.
no questions from the chat. If anybody wants to ask any question on this. Yeah.
Thank you very much. First of all, I would like to apologize for my level of English language. I will try to ask clearly. How can our medical information, for example, from the community in Russia, can be used in, for example, in Great Britain? Can you trust for this research and the numbers of each patient? Because we have different equipment, we have different university, different type of research. So how can it help you? My son is 2 years old, and we have book like this of the research and a lot of information in it. How can you trust, for example, in Europe, to this information?
If I understand correctly what you're saying, I think I will try to answer to this question. I think at this current time, the guidelines are, we are aiming to actually, helping to give you tools to your clinician in your country, tools that you can use and you can show to your clinician, and to make sure that the care that everybody, independently which country you live, are similar, and there's a minimum standard of care. If you live in Russia, United Kingdom, Turkey, wherever, it's there. So we are asking experts, so for example, your clinician in Russia, if they see a lot of patients with the condition, in this case LAMA2, they can help us, and we are welcome experts from all around the world to get this information. We will curate this information to make sure that the information that then we give out is as correct as possible. So we are looking for experts, and then we will look for patients and families to make sure that the information is usable. I don't know if that is...
And maybe I can add, we're trying, if all the information is there, we're talking with an IT expert to make like an app, so it's easy to find. So you can search on a topic, or you can search on age or whatever. So it's easy, accessible information. But that's the next step. First, we have to get all the information here.
Got it. Thank you very much.
And hopefully this could be translated in as many languages as possible to also, break the language barrier as well.